My name is Maxine Jochelson, and I'm a radiologist who specializes in breast imaging, both clinical work, taking care of patients, as well as research in the field of breast imaging. What we have learned is that while mammography is a great tool, it is imperfect, and particularly in women who have dense breasts, it's hard to find the cancer sometimes. Over the years, various other tools have been developed to help find cancer in those women. Contrast Mammo was developed to use the idea of enhancing those new blood vessels, but on a platform of a mammogram rather than the MR machine. We give women contrast. It's a little different from the contrast that we use for MR. And then we do a special kind of mammogram where we can see the regular mammogram and then the contrast part where it goes to the cancers as two separate images that are obtained within a second of each other. To compare it to the normal mammogram, the difference is that the patient gets an IV and the contrast. And other than that, for her, it's like a regular mammogram. I think that people don't recognize that we are seeing cancer, breast cancer in younger and younger women every year. More recently, I've started seeing 20-somethings get breast cancer. We take risk of breast cancer, and we divide it into high, intermediate, and normal. High risk is greater than 20% chance of developing breast cancer in your lifetime. Intermediate is 15 to 20%. And then normal is less than 15. So the intermediate risk are a group of women that we really think about when we think of contrast mammo. But there's also a population of women who have what's called extremely dense breasts. And they're at higher risk for breast cancer, and they're the hardest mammograms to read. We find significantly more cancers if we give the contrast. And the other place that we're beginning to use it is in the women at the highest risk with the mutations, that instead of doing mammo 6 months later MR, we're suggesting doing contrast mammo 6 months later MR, because these women get these really fast-growing cancers. And this way we give them vascular imaging twice a year, but different contrast agents. More and more institutions are getting contrast mammography. It has made it to some of the big guidelines. So the NCCN guidelines, which are big guidelines for showing how to take care of cancer patients, and also the American College of Radiology guide. So these are the national guidelines, are now beginning to put contrast mammo in because they think that the literature is good enough to say that we should be using this.